Good health and good sense are considered to be two of life's greatest blessings. Now, we did speak about good sense in the first segment, and now it's time to talk about good health in Aster Love Yourself to Live Healthy segment. Do you know that urinary tract infection are responsible for near 10 million doctor visits every year? UTI is widely prevalent, and highlighting the cause and the precautions for UTI is Dr. Mahavir from Aster Clinic and Hospitals. Well, today we are talking about urinary tract infection. My first question obviously is, what is UTI?
The urinary tract comprises of the kidney, ureters and the bladder, and the urethra, that is the urine passage from which we pass the urine. And any infection of the bladder or the kidney or the urethra is called as urinary tract infection.
What are the causes of UTI?
Causes of UTI are different in children and in adults, and also in women and in men.
Okay.
So we are discussing about women. The most common cause of UTI in women is constipation, or UTIs are very common in the reproductive age group.
Okay.
So having an intercourse itself can make the woman prone to UTIs.
UTI.
Yeah.
What are the symptoms, doctor?
The symptoms of UTI commonly are burning in the urine, which we call it as dysuria. But there can be other symptoms such as pain in the lower abdomen, pain in the back, there can be fever, there can be blood in the urine. But some patients may not have any symptoms. Prevention can be done by taking care of some things, such as after using the washroom, when you are abluting, if you are using water or wiping, the wiping should be from front to back. And if you are sexually active and married, and if you are getting recurrent infections, especially after intercourse, you can take a course of a single dose of antibiotic. The doctor can prescribe you that. And delaying urination, when you feel the urge to pass urine, also should not be done. Especially you should take care at night that before going to bed you empty your bladder and then go to sleep, because the bacteria which commonly cause urinary tract infection are E. coli, and their multiplication time, doubling time, what we call as, is only 20 minutes.
Oh,
yeah,
okay.
Yeah. So keeping urine in the bladder for a longer time increases the chance of infections.
What are the treatments?
Commonly we prescribe antibiotics which take care of the infection if it is a common bacterial infection, which I just said, like E. coli. But urine culture also guides our treatment as to what kind of antibiotic can help in case the patient is not better by 2 days. So drinking adequate amount of water as and when you are thirsty, and taking care that the urine that is being passed is clear like water, or very light straw colored, straw yellow colored urine. In this aspect, I would like to emphasize that using antiseptic solutions is not recommended.
Not recommended, yes.
What it does is will not prevent infections, and if infections occur, they will be more resistant infections. So
Do these infections also affect kidney?
primarily 80-90% of the cases, the infection starts with the bladder. So if it is untreated, or if the bacteria are very virulent, that means they are very strong and our body immunity cannot take care of it, then the infections can rise up to the kidney, which we call it as pyelonephritis, and that can be a serious condition, because the patient might need to admission in a ICU and injectable antibiotics.
But it can be prevented if it's diagnosed at the early stage?
Yes, definitely. If it is diagnosed at an early stage, just giving antibiotics which are commonly used can help.
Thank you, doctor, for coming here and giving us such amazing information on UTI.
Thank you, Uma. It was my pleasure.
My pleasure.